My name is Dr. Kristen Rodzinka. I am the Trauma Recovery Clinic's Program Manager here at the Dayton VA, and I'm happy to be speaking with you. Perhaps the most important thing I can communicate to you is that we are here to serve you and have services that are available to meet your needs. The Dayton VA is a comprehensive medical center. We provide a full continuum of services. This includes medical and mental health services, and more specifically, a wide range of services to address PTSD. Veterans who enroll in care with the Dayton VA should expect to receive excellent trauma-informed care in every department and program as we work with you to meet your medical and mental health treatment needs. We have a trauma recovery clinic with exceptional PTSD specialists that provide the highest quality evidence-based psychotherapies for PTSD. We also have highly trained mental health staff across all levels of service, from mental health providers embedded in primary care, outpatient mental health programs to include substance use disorder services, our mental health residential programs, and an inpatient psychiatry unit. There is not one right way to engage in services. We will do an assessment and collaborate with you to meet your needs and find the best way to address your treatment goals. So what is PTSD? PTSD, or post-traumatic stress disorder, is a mental health condition that may develop after you go through or see a life-threatening event. It is normal to have stress reactions to these types of life experiences, and most people start to feel better after a few weeks or months. It's normal to have upsetting memories, feel on edge, or have trouble sleeping after a traumatic event. At first, it might be hard to do daily activities you're used to doing, like going to work, going to school, or spending time with people you care about. But for most people, they start to feel better after a few weeks or months. For others, PTSD symptoms may start later, or they may come and go over time, especially with life stressors that can come and go. If it's been longer than a few months, and thoughts and feelings from the trauma are upsetting you or causing problems in your life, you may have PTSD. If your service in the military has caused you to experience stress or impair your ability to engage in the daily functioning that you desire, we really want you to come in and get services. We are definitely here to help. Now, anyone can develop PTSD at any age. Some factors can increase the chance that someone will develop PTSD, many of which really aren't under that person's control. For example, having a very intense or long-lasting traumatic event, or getting injured during the event can make it more likely that a person will develop PTSD. PTSD is also more common after certain types of trauma, like combat and sexual assault. Unfortunately, experiences that can be common during military service. Personal factors can also contribute, like previous traumatic exposure, one's age and gender. All these things contribute to whether a person develops PTSD. What happens after the traumatic event is also critically important. We know that stress can make PTSD more likely to develop, while things like good social support can make it less likely. So what are the actual symptoms of PTSD? In order to be diagnosed with PTSD, you have to have experienced a traumatic event, and after this event, then develop symptoms associated with the trauma. They usually start pretty soon after the traumatic event, but they may not appear until months or years later, and can also come and go over the course of many years. It's not until these symptoms last longer than 4 weeks, cause you great distress, or interfere with your work or home life that we would start to consider whether you might be diagnosed with PTSD. And there are 4 types of PTSD symptoms, but they may not be exactly the same for every person. In fact, each person experiences these symptoms in their own unique way. The first set of symptoms are the re-experiencing symptoms, so reliving the event. This can come in the form of memories that can pop into your mind at any point in time. They can feel very real and scary. This can include things like nightmares while you sleep. It can happen throughout the course of the day where you feel like you're experiencing the event again. You might also see, hear, smell things that cause you to relive the event. These are often called triggers, things like news reports, seeing an accident, hearing fireworks, things that can be activating to some of our veterans. The second key symptom is avoidance. After experiencing a trauma, it's not unusual to not want to have to feel that way again. So what happens is you might try to avoid situations or people that remind you of the traumatic experience. You might even avoid talking about or thinking about the event. For some people, they might avoid crowds because they feel they're dangerous. You might avoid driving if you were in a car accident or if your military convoy was bombed. You might also find other ways to avoid, like keeping super busy or avoiding getting help so you don't have to think about or talk about the event. Kind of even that experience of pushing it away. The third set of symptoms has to do with experiencing more negative thoughts and feelings than before the traumatic event. The way you think about yourself and other people might become more negative because of what you experienced. Might start to feel numb, unable to have positive or loving feelings towards other people. Sometimes people lose interest in things they used to enjoy. You might even start feeling like the world's completely dangerous or that no one could be trusted. You might feel guilty or ashamed about what happened. I have a lot of, I call woulda, coulda, shoulda thoughts, wishing you had done something more to keep it from happening, feeling like you should have been able to prevent it. Finally, the last set of symptoms we call hyperarousal. This is where you feel all keyed up or on edge. So you might find yourself just feeling really tense or jittery, always being on the lookout, on high alert. This can also cause people to become angry or irritable, like kind of a short fuse. It can cause hard time sleeping, might find it hard to concentrate. And you might act out in unhealthy ways, like smoking or using drugs or alcohol or driving aggressively. So one of the most important things people may want to know is, can you get better? And I'm here to tell you, yes, you absolutely can get better. After a traumatic event, it is normal to think, act, and feel differently than usual. Sometimes people feel like they want to go back to being their old self. While most people start to feel better after a few weeks or months, if you are still continuing to struggle, we want you to get treatment. If you are distressed, if it's disrupting your daily life, if you cannot live the life that you want to have, we want you to get into treatment. While we cannot go back in time and undo a trauma event, there is so much we can do to help veterans come to have a different relationship to their trauma and end the suffering that can accompany unresolved trauma experiences. Now, there are many different treatment options for PTSD. This is good news because it means we don't have a one-size-fits-all approach. And if you're someone out there that has tried treatment before and it didn't work, I really want to encourage you to come back in and talk with us again. For many people, our treatments can get rid of symptoms altogether. Other people find they have fewer symptoms or feel like their symptoms are less intense and more manageable. Your symptoms do not have to interfere with your everyday activities, your work, and your relationships. We want to help you have the life that you deserve. So what kinds of treatments are available? The VA can provide you with a whole range and host of treatments. Both trauma-focused psychotherapy, sometimes called counseling or talk therapy, and medications are proven to treat PTSD effectively. And sometimes people combine psychotherapy and medication together. Trauma-focused psychotherapy is the most highly recommended treatment for PTSD. Trauma-focused means that the treatment focuses on the memory of the traumatic event that is bothering you or the meaning of that event. And the most effective types of trauma-focused psychotherapy are all available here at the Dayton VA. A lot of people may feel anxious about what will happen if you come in for services. The first thing to know is we're always going to start with an assessment. Every person is unique and has their own experience, and so we're going to want to get to know you and your symptoms and also your preferences related to your treatment needs. As a part of this assessment, we'll give you feedback about our understanding of what you're experiencing and engage in what we call shared decision-making, where we'll teach you about the treatments that are available that we think will help you and give you choices and opportunities to partner with us in developing your recovery plan. The Trauma Recovery Clinic has psychotherapists who are trained in a range of evidence-based treatments for PTSD. Some of the most common and strongly recommended treatments include cognitive processing therapy. This is a treatment where you learn skills to understand how trauma changed your thoughts and feelings, and changing how you think about the trauma now can change how you feel. Another is prolonged exposure. This is a treatment where you talk about your trauma repeatedly until the memories are no longer upsetting. This helps you get more control over your thoughts and feelings about the trauma, We also spend time going to places or doing things that are safe, but maybe you haven't been doing because they remind you of the traumatic event. Another is eye movement desensitization and reprocessing. You may have heard it called EMDR. This involves focusing on sounds or hand movements while you talk about the trauma. This helps your brain work through those traumatic memories. Another newer evidence-based treatment we offer is called written exposure therapy. This is where you do some writing about the event. We have had great success, and these interventions can be as short as 5 sessions or ranged to around 12 to 16 sessions.
Hello, my name is Dr. Franklin Halley. I'm a psychiatric medical director here at the Dayton VA Medical Center. Here at the Medical Center, we have a large group of psychiatric prescribers that includes psychiatrists, advanced practice nurses, and physician assistants. We collaborate with the PTSD therapists to provide the best comprehensive treatment to our veterans. We are able to prescribe medications to help with the emotional and physical reactivity that often exists with PTSD. We treat the co-occurring mood and anxiety disorders. We help with nightmares, and we help with sleep problems. We also are able to provide MAT, which means medication-assisted treatment services for those with associated substance use issues such as alcohol. We provide services here at the Dayton VA Medical Center campus, as well as the 4 outlying C-Box. Appointments are available in person, over video, and sometimes when appropriate on the telephone, and we can do those through all of our locations.
One of the things that is important to know is that we are aware it's very common for people who are struggling with traumatic memories to maybe be coping or dealing with them through use of substances. Substance use disorders are fairly common and are something that we are very well equipped to help with. We can provide integrated treatments that address both PTSD and substance use disorders at the same time, and can work with you to meet your goals related to your substance use as well as managing your PTSD symptoms. Interventions can include integrated psychotherapies, concurrent treatments, and also medication management to include medication-assisted therapies for substance use disorder. In addition to substance use disorders, other mental health conditions can co-occur with people who experience PTSD. In fact, PTSD may be more common for someone who's already struggling with a serious mental illness or depression. The good news is that we can treat PTSD even if you are struggling with other mental health issues and concerns. In addition to coming in for treatment, one of the great things the VA has is readily available resources that we can put right at your fingertips even today after you finish watching this video. The first one I really want to highlight is called the PTSD Coach. It is a free app you can download to your phone and can even be a little bit individualized to meet your needs. You can assess your current symptoms, but my favorite part is that you can tell the app what symptom you're struggling with, and it will direct you immediately to a skill you can use right now. If you don't like that particular skill it's sharing with you, you can skip it and it'll be happy to give you the next one. It's kind of like having a therapist in your pocket. And for all those loved ones who are out there listening to this, there's also a PTSD Family Coach app. That app is actually designed for loved ones who want to manage their own symptoms and struggles and also support their loved one with PTSD. Another app that has come out is called Beyond MST for our military sexual trauma survivors. It is really geared towards helping sexual trauma survivors cope with the aftermath of those experiences, and I cannot highly recommend these anymore. Put those in your phone and share them with lots of people. Additional resources you can find if you're looking for more information are available at the National Center for PTSD website. 2 resources I'd really like to highlight are the About Face videos. This is an opportunity for you to almost have a conversation with other veterans who've engaged in treatment. Learn their struggles, but also learn their reasons for engaging in treatment, hear a bit about what their experience in treatment was like. If coming in to talk with us may still be a little bit scary, this is a great opportunity to get a sense of what treatment might be like for someone like you. Also, There are a series of whiteboard videos that explain a little bit about many of the treatments that we provide and even what evidence-based treatment really means. At this point, I hope you know that we are here and are ready to serve you. If you are struggling or suffering because of your service in our military, we really want to strongly encourage you to access the services that you need and deserve. In order to receive care at the Dayton VA, we need to start by making sure you're enrolled. If you haven't done that yet, we'll have you start with our enrollment office. But once you've established yourself as a patient at the Dayton VA, there really should be no wrong door. Many of our veterans start to receive mental health services by talking to their primary care provider about that and maybe getting linked to our primary care mental health integration team.
I'm Dr. Lindsay Miller. I'm a clinical psychologist and the program manager of primary care mental health integration. And we are a behavioral health team that's housed here in primary care that can actually see you same day to assess your mental health needs and assist you in getting connected with mental health services. So we may be able to offer you some brief services here in primary care, whether that be brief individual therapy. We also offer a wide range of different classes that are skills-based and can give you some tools that you need in order to better address your symptoms. If that's not appropriate for you, we can also connect you with other clinics. So the mental health clinic, the trauma recovery clinic, or other mental health services that we offer here at the Dayton VA.
While many people start in primary care, it is also perfectly acceptable for you to call our general mental health programs or our trauma recovery clinic to ask questions or have us assist you in getting linked to care. In addition to having a broad range of services available, I also want to make sure we point out the fact that we have different modalities of treatment. So many of you may think of a traditional come into the facility face-to-face service. We definitely still provide that opportunity, but for many people we've found that virtual services, like through our Veterans Video Connect, have been extremely successful in meeting people's recovery needs while also making it more accessible. We do have community-based outpatient clinics for those folks who don't live as close to the Dayton VA facility, and you can both enroll and get your care through any of these facilities. Thank you so much for your service and your time. We are here to serve you. Please reach out if there's anything we can do to help you.